It's a pre-workout, huh?
Exactly.
Pre-workout.
See?
Jeans are cute. Everyone's jeans look so cute today.
All right, when we look at the neck muscles, if you just look at the names, it gets really confusing. Sternohyoid, thyrohyoid, omohyoid. You think, how am I ever going to learn this? But if you learn your landmarks, the sternum, which we know the sternum, the breastbone here, the sternum, the thyroid, which is kind of like the Adam's apple, and the hyoid, which is the support of the tongue. So hyoid, thyroid, sternum. If you remember those three landmarks, then you just go, okay, here's a muscle going from the sternum, and it dead ends in the thyroid. So sternothyroid. All right, so easy. What if a muscle goes from the thyroid to the hyoid? Thyrohyoid. What about a muscle that goes from the sternum all the way to the hyoid, which in this model it's cut away, you know, so you can see the other muscles, but here we can see it. It goes from the sternum to the hyoid, so we'll call that the sternohyoid. Okay, so on a test, just look at where the muscle goes, and there's the name. Now there's some exceptions. The omohyoid is going to just dive off to the shoulder, so that's the omohyoid here. Under the chin, there's two muscles that are called digastrics, because gastric means stomach. Stomach-shaped muscle, there's an anterior belly and a posterior belly back here. And they both look kind of similar. There's kind of rounded muscles, which is kind of odd right there. And then under the digastric is the mylohyoid. Mylohyoid, you can feel it on yourself, okay? Just under the digastrics, mylohyoid. So that covers the anterior muscles pretty well. If we look from the side, here's probably a better view. We have the large sternocleido for clavicle, mastoid, sternocleidomastoid. Then on the back, and we can probably see it better on this model, the most superficial muscle, superficial means at the surface, right? The superficial muscle here is the trapezius, which is a trapezoid muscle going all the way from the back of the head to the scapula and down the thoracic. If you pull this away, you have the rhomboid minor and major, and you have the splenius capitis right here. So on this model, I showed you that because here, you know, now you can see this would be the trapezius. This would be the splenius capitis, because capit, think of decapitate or something. Capit means head. Splenius capitis. You see how the muscle fibers are going different than the trapezius? The trapezius coming down and out to the shoulder. The splenius capitis kind of coming away. And then we have the splenius cervicus, because it's going to go into the cervical vertebra of the neck. So splenius capitis, splenius cervicus. Here's the levator scapulae, which I wish I had a better view of it, but it's going to go all the way down and elevate the scapula. And then right inside here, you get a little peak, what's called the scalene muscles of the neck. That's the middle scalene. Right. I think that covers it. Erector spinae, you'll see that in the cadaver. So in the erector spinae, if it's close to the spine, that's the spinalis. If it's the one next to the spine, that's the longissimus. And the one furthest out is called the ilicostalis. So I love spinach.
Yes.
Ilicostalis, longissimus, spinalis. If it's up this area, we're going to call it cervicus. So it's covered, but it'd be spinalis cervicus. If it's here, then this is spinalis thoracix. And if it's down here, it's going to be called like the spinalis lumborum. So on a test, you got to give a full answer. If I have a pin on a cadaver right there, what would you call that? Well, look where I am. I'm way on the outside. Ilicostalis, what?
Thoracic.
Thoracis, okay? And if we pulled this away, so forth. So remember that. 2 names on those. All right. I think